I've talked before about the enormously high cost of healthcare in the United States, and how that's largely due to overregulation, but most people don't have really a grasp of just how corrupt and mismanaged our healthcare system is, partly by the government. So I want to provide an example of that, because if people don't get just how bad it is, we don't really have much chance of fixing it. So one example is happening really close to me in a city called Winston-Salem here in North Carolina. There's a surgeon whose name is Dr. Granger Singh, and he provides transparent pricing for surgeries. What I mean by that is you can go by his website and you can look at whatever surgery it is that you need, and he's got a price right there, and it includes everything that you would need for the surgery, the anesthesia and any medications that you need, etc. And because of this model, he gets people traveling from all over the country to come and visit him and have their surgeries done. And his prices are significantly lower than you'll find at other places throughout the country. He often recommends scans, like x-rays, etc. And one of the places where his rates were still high were the scans, because he wasn't doing them himself. He was sending people off to a different place, like a local hospital, and getting the scans done there. Well, patients kept complaining to him that the cost for the scans were in many cases more expensive than the surgeries that he was doing. So he decided to tackle this problem too, by opening his own place called the Forsyth Imaging Center. Forsyth is the county. And the whole aim of the thing was to have high-quality, low-cost scans that would complement his own surgery. He's like taking on the medical complex in a very small way. He's aiming to fix it. Well, just to provide an example, right? A common echocardiogram, which is like an ultrasound of the heart, costs about $2,000 throughout the United States. There's a common price for it. He charges $200, so a tenth. That's the kind of disparity that we're talking about. And this guy, he acquired all but one machine for his imaging center. He has an X-ray, he has an ultrasound machine, and a CT, otherwise known as a CAT scan, but he doesn't have an MRI machine. He's banned from purchasing an MRI machine because the hospital down the street has one. This is where the corruption really comes into play. You see, he is prohibited due to what's known as a con law. Seriously, con law. That means certificate of need. And that's where the state, this happens in a lot of states, not just North Carolina, but the state requires healthcare providers to demonstrate a need for medical devices, medical equipment. They have to go through this bureaucratic nightmare where they write after the state for permission to buy something. Well, it's even worse than that in North Carolina, because you can't even do that. The state must first project a need. Like at the beginning of the year, they have to say, well, based upon how many different, places are operating, we project that there'll be a new need for an MRI machine. Some bureaucrat decides this. And the whole point of this, these con laws, they were originally justified to reduce costs. So here's the thing. The government will reimburse these different healthcare providers for this medical equipment. He's not asking for that, but that's what they do. And that's how corrupt it is. But yet, these con laws, they apply to healthcare investments that are completely private. Like Dr. Singh, he's not asking for the state to give him the free machine, or to reimburse him for the cost. He just wants one. That's it. But he can't get one. But these other hospitals and so forth that are requesting the state to reimburse them, they should cap how much, the state should cap how much they can charge for these scans. Because at the end of the day, if the public is paying for the devices, which they are in such cases, the public should benefit from them. What sense does it make? You spend several $1,000s for an MRI scan. Like, this guy wants to charge like $400 for an MRI scan, and he had done that previously when he was renting equipment. Whereas in other parts of the country, you're paying like $3,000. At places where the public has paid for the machine. Does electricity cost that much? No, it doesn't. But very few Republicans comment on ways that we can actually make healthcare more affordable. They kind of dodge the topic. And Democrats, they just promote socialized healthcare, which worsens the regulatory nightmare. It makes this thing, which is, this is one example of regulatory hell, but it kind of expands that into every area of healthcare. And whenever bureaucrats are spending other people's money, they're not going to do so in a cost-efficient way. So, even if Dr. Sink could apply for, this permit to get an MRI through this con law, if the state both projected a need and he was able to apply because he could demonstrate that there was a need, his competitors could petition against his right to have one. That they could argue that the existing places, like local hospitals, local doctors' offices, could argue that he doesn't get one. And if that's not protectionism, I don't know what is. The local established providers have a government-enforced monopoly, can keep out the little guy. The Institute for Justice is defending Dr. Sink and suing the state of North Carolina. And they said that going through this whole process to obtain a permit can cost around $400,000. $400,000, almost $500,000. And, you wonder why the costs of healthcare are so high. Stuff like that is why it's so high. A $400,000 regulatory fee just so that you can go and buy a machine later on. That doesn't even cover the cost of the machine. You have to go buy the machine after that. And the North Carolina Constitution, like a lot of state constitutions, forbids special privileges. It forbids monopolies specifically. So the Institute for Justice will probably win. It'll probably get overturned in this case. But this is an example, of the nightmare that happens. And when you have more socialized healthcare, when you have more bureaucracy, it's only going to get more expensive. You're going to have more regulatory nightmares. You've got the situation, essentially, of foxes guarding their henhouse, playing with other people's money. And there's a growing movement. Now, this is why I mention this, because this is not just this one guy, but there's a growing movement of doctors who are no longer accepting insurance. It's this phenomenon. It's called direct primary care. And that's where, like I was saying earlier, you can go to this doctor's website and you can look up the fee for what have you, and the fees are significantly lower than they would be otherwise. And in a lot of cases, these direct primary care doctors will have like a subscription fee service where I think on average it's about $100 a month for a family of 4, and basic care is covered. We're kind of moving back away from the insurance kind of system and the bureaucratic kind of system, which the two go together actually. There's a lot of regulation that the insurance companies have to deal with. And the insurance companies like the cost of healthcare to remain high, because as long as those costs are high, they can convince people that they need insurance. You see. Alright. But with these direct primary care doctors, they can opt to use newer, better technologies. Like, for example, if you've got something physically wrong, maybe you've got some kind of rash or outbreak or what have you, you can send a picture to your doctor, right? And he can figure out what it is before you show up. Or maybe you don't show up. Maybe he just sends a prescription to your local pharmacy. That kind of thing. That can't be done at a lot of doctors' offices now because they have to rely on they have to work within regulatory requirements and insurance requirements. So what we're talking about is a lower cost of care that is also better, right? And it's prevented. In fact, the IRS, that's the Internal Revenue Service for people who are outside the United States, they deal with taxation. Well, it doesn't allow patients to use tax-deductible health savings accounts to pay these doctors. So the whole point of those accounts, right, is that you put some money to the side and it's tax-free, and you can use it if you have a medical crisis or health condition or what have you. But the IRS won't let you use that money for these doctors that have invariably cheaper, invariably better care. That's the government for you. Literally preventing innovation. If you are the average American, you have no idea just how corrupt the whole healthcare system is. And I mean in different ways. There's both the financial aspect and the kind of darker aspect that results in the deaths of patients. If you want to dig down the rabbit hole, I don't usually do this, I try and keep this out, but if you want to dig down the rabbit hole, I co-authored a book called Defy Your Doctor and Be Healed. Take a look at it. You can also look at our website, healthwise.org, and start digging there too. Either way, but there's so much in the healthcare debate. But what I hate is this idea of the false dichotomy where people argue as if the only two options are Obamacare or Medicare for all versus unaffordable care where some people end up dying because they can't afford to see a doctor. That is not true. Having those two options, that's not true. You have doctors like Dr. Singh and others doctors around the country. You also have alternative care too, but I was leaving that out for the most part for this. But, there are options that are better. So don't buy into that argument that we only have two options. Either everyone's going to have the same socialized care or people are going to die. Because that's not true. We can do better. Alright, thank you for listening to this. If you enjoyed it, please like it and share the video and get the word out. I can't do this without you. Also, subscribe, hit the bell, and I've got a link in the description that'll provide you with better ways to be notified reliably of new videos. I also have other links that'll provide you with ways to support the production of these videos. Thank you to those who have already. Bye-bye.
Check out our official products at our home site, healthwise.org. We have been helping people to live better and healthier lives for a decade. Our products tend to be more effective than other products, as they work with nature instead of against it. We recommend our colloidal copper lotion, which is our flagship product, or everyone's favorite, the dental cleanser. Thank you for listening and for your support.